It's my duty as per usual to share with you the HEOC situation report for today, April the 21st. To date, the Federation would have reported 44 cases of COVID-19, and all 44 cases have fully recovered. We are not monitoring any active cases at this time. Between last January to present, health professionals globally have been following up this pandemic. Despite the massive COVID-19 vaccine rollout globally, the pandemic continues. To date, 142.2 million persons have been confirmed with COVID-19, and as Mr. Williams just noted, over 3.03 million persons have died from this disease. And as I said earlier, globally, there has been a rollout of the COVID-19 vaccination process, and over 843.2 million doses of the various vaccine candidates have been administered to individuals. 31.8 million of the confirmed cases were reported by the United States alone, and over 568,000 deaths were reported by the USA. The pandemic continues in the Caribbean region, so we are not spared. Amongst the CARICOM member states, 152,476 confirmed cases were reported, and over 2,500 deaths have been recorded amongst the CARICOM member states. Now, amongst the Organization of Eastern Caribbean States, meaning the 9 OECS territories, we have a total of 11,663 confirmed cases of COVID-19, and to date 156 deaths have been reported from the OECS member states alone. Now, similarly to St Kitts and Nevis, well, as you are aware, in St Kitts and Nevis, we've rolled out our COVID-19 vaccination program, and so too the other OECS territories. And so you can look at the status of the vaccine rollout in Barbados, for example. They would have administered over 66,000 doses. They would have provided coverage to about 24% of their population with at least the first dose of the Astrazeneca Oxford vaccine. Similarly, Antigua continues their vaccine rollout. They've covered about 30% of their population with the first dose. Dominica has covered about 25% of its population with at least the first dose. Montserrat, about 30.8% of the population with the first dose. Now, in the Federation of St Kitts and Nevis, as at this afternoon, we would have administered 11,848 doses of the Astrazeneca Oxford vaccine to our people, and in other words, we would have covered 35.86% of the target population with the first dose of this vaccine. Now, in terms of breakdown, we would have administered 8,935 doses in St. Kitts, 2,913 doses in Nevis, and these figures are as at this afternoon, after closure of the health centers. We continue our active surveillance program, whereby we are monitoring everyone who would present into our emergency room with signs and symptoms or COVID-like signs and symptoms. They are all tested. We also continue testing all inbound passengers coming in from hotspots. And so to date, we would have tested well over 13,000 persons with a positivity rate of only about 0.3%. Next slide. We continue offering the Astrazeneca Oxford vaccine to our people. I just want us to be reminded that once you are fully vaccinated, and full vaccination means you would have received the 2 doses of this vaccine, and we are administering the doses 10 weeks apart. WHO advises us that if you administer these 2 doses 8 to 12 weeks apart, the individual who is fully vaccinated can enjoy 83% risk reduction in contracting COVID-19. We're offering it to adults over 18, and please note that this vaccine provides good protection against the SARS-CoV-2 variant identified in the United Kingdom, and also based on the latest science coming out, this vaccine also provides you some protection against the SARS-CoV-2 variant identified in South Africa and Brazil. These are the common post-vaccine symptoms as described by our people, and these are the symptoms that have been voiced by those who would have received the vaccine locally. Tenderness at the injection site, mild fever relieved by paracetamol or acetaminophen, just general malaise, fatigue, tiredness, generalized body aches and pains, and mild headache. Now, to date, the Federation would have received a total of 41,600 doses. So initially, we received 20,000, and then on April 7th, we received an additional 21,600 doses. Now, ladies and gentlemen, the shelf life for these vaccines is quite short. And so we have to use up all these vaccines by the end of June this year. So persons are saying, I'm going to wait. Please note that the shelf life of the vaccines quite short. They must be utilized on or before the end of June this year. Again, as a federation, our aim is to attain the herd immunity threshold. Now, the science tells us that this is anywhere between 70 to 90% of our population. But in our situation, based on our last census, the adults in St. Kitts comprise about a little over 70% of our population. And so our aim is to vaccinate 70% of our population, the adults in our population. And based on the rate at which we are vaccinating, we hope to achieve this goal by about September of this year. And so we are hoping that most of the adults would come on board in terms of accepting this vaccine. Protect yourself against COVID-19, choose to vaccinate, because in so doing, you will be protecting yourself. Because as I said before, once you are fully vaccinated, you would have an 83% risk reduction in picking up the virus. Very, very small risk. So in other words, let's put it in ordinary terms. If perchance we have clusters of cases of COVID-19, if we go into community transmission and the virus is spreading, once you are fully vaccinated, the risk of your contracting the disease is very slim. And if perchance you do, it prevents you from becoming very ill, it prevents death. Now, just some new information coming out of the New York Times about 2-3 days ago. So researchers have reported on a new study, and they were looking at air travel. And what they found is that if the airlines were to keep the middle seats vacant during flight, this could reduce the air passengers' exposure to COVID-19 by as much as 23 to 57%. And so I'm really hoping that the airlines take this new scientific bit of information on board. And so, ladies and gentlemen, as we continue our COVID-19 vaccine rollout, as I said before, we are just at about 36% in terms of coverage with respect to the first dose. So we still have some distance to go, and so we need to be reminded of the essential public health measures that have proven to be successful, whereby you wear your face mask when you're in public spaces, maintain hand hygiene, maintain that safe distance from others when you are out attending a function or in the public domain, and try to avoid crowds still. Thank you.